So just really quick, the video coming up here is a test. Let's see how well you know your terms and how much you can pay attention. So if you've been watching the videos and you've been educating yourself and defining the terms and see what they mean, you should be able to follow what I'm talking about. This is technically what I think when I'm working on you, but I don't say any of it because I don't want to get into the explanations with you because it takes too much time. That's why I give you the bare minimum. But if you want to know exactly what I'm thinking, I do a better job of trying to just say what I'm thinking and not so much explain that. So if you don't know what I'm saying, a lot of it's going over your head, watch the videos and come back.
A
Test
little bit
yourself
that
again.
way. So if the head's tilting, it's usually a muscle that's doing it. Most issues are chronic, so you can feel this muscle's tighter, that runs attaches there. So that's constantly pulling. It can not only knock bones out of place, but cause arthritis in the future. And when you have constant muscular imbalance, when you're sleeping, that's when people get the kink neck. You shouldn't sleep in a funny position and have a kink neck that shows there's bad muscle tone. You can also see that he's kind of pitched forward, his head pushes that way, so these muscles are tight, especially on the left, it's tighter. So he could have issues in the neck. You feel like in the middle it's very gushy and weak there. It should be more engaged here and lengthened, so he gets a little taller. That's good. Pretty good definition down here. Pretty good there. You can feel a lot of gushiness. Same gushiness here is also here. This could be causing that for sure. Let's look at his hips. Pretty good, because he does a lot of squats, so I'm not seeing a lot of issues here. But remember, it's all about the spinal cord. And the spine, the bones will make changes to compensate for the nerves, because they want the nervous system to be happy. So they'll contort themselves and do whatever they can to take pressure off the nerves. So yes, neck issues can cause lower back issues. So if he's got a weakness area here and he's deadlifting, even if he's has good proper form, he could still injure these discs, sprain these joints because of the neck issue. The neck controls you. It's like the head that's like in that Greek wedding movie. Man may be the head, but the woman is the neck, and she can turn in any way she wants. So yeah, the shoulder height's a little different. See, that's elevated over here. Can't see it, but his right shoulder's turned in. But like I said, hips are pretty level. That's what we like to see. Let's turn them to the left. Whole body, feet together. So now he's listening to me and he's trying to lean back a little bit, you can tell. You want to get that weight in your heels. Engage that core a little bit. Right there, engaging that neck. That looks pretty good. So not bad on the stance. A little overdeveloped in the pecs, like most men are. So those turn in a little bit, and that rounds this area, and that affects the neck. So you got a little bit of hump too. So let's see what we can find on them. What I use is neurological reflexes, having the body tell me what to correct. I get strange things. It's funny, the first thing I'm getting is actually the upper joint, called the occiput atlas joint here. Atlanto-occipital joint. And of course it's on the right, so we're going to correct that. That's between the first bone in the neck called the atlas and the occiput. So they're jammed in, which I said that muscle's tight. For most people, it's chronic issues causing what we call the subluxations. So lay on your back, let's fix it. And the areas that are jammed up are not always the areas that hurt. Usually it's the area that is sprained. So you can sprain a joint like you strain muscles, you sprain joints, but it's the same idea. It's an overstretch. So you have joint tissue that's overstretched, just can't do its job right. It can't keep the bone together. So if he's tight on the left, he might not have pain on the left. He's probably going to have pain on the right, over here, where that joint is stretched. So what I do is I loosen up the one side to make it a little more even. Any soreness there? Yeah, on the left, actually, yeah. So what we do is we put it in the proper position. It looks like a lot of motion, but it's really not. It's just moving it a tiny bit. Let me see your arms. Check the length, because the length tells us about the neck if there's tension. see a pretty big difference, probably an inch. When I fully stretch there, pulling equally, he's got a big difference there. So turn your head right. We're seeing if the neck's involved. It might not be the neck. But look at that, it evens it out, right, when he turns right. So he's correcting something temporarily when he turns to the right. So it shows us it is the neck. We just got to find out where it is. So that middle neck is weak, and you usually don't want to adjust the weak area. It's prone to sprains. A lot of chiropractors injure people because they're adjusting the sprained area. They don't feel like it's an injury at the time, but everything pops, and oh, it feels good, but it keeps going out, and they got to pop it all the time. And if you have to crack your neck all the time, that shows there's muscular imbalance there. So it keeps coming out of place, not correcting the issue. See those arms again. So we didn't hear a pop when he did his neck either time. So that means there's lots of atrophy in the neck. But it's still corrected. So the bone went in without a pop. So some people will do better with lighter touch chiropractic because you either have restricted areas which need some force, or you have what we call hypermobile areas. There's too much motion, so they just need light correction to put the back into place, and then you need to strengthen that area to make them stay in place. So Jared, I'm always watching, he's doing this all day. He's popping it in, it goes back out. Pops it in, he's got to do that what, all day long? All day long. Standing. So that shows there's muscular balance, atrophy in the neck. Makes sense? Mm-hmm. The head's level. That's good. So usually, I mean, there's something sprained there. So usually they won't feel better after the adjustment. But neurological, because chiropractic is not about neck pain and back pain. It's about removing nerve stress, balancing the body out. If you want to get rid of pain, it's about strengthening the spine. Just because you're not in pain doesn't mean you don't need chiropractic. So let's see if we can loosen up that shoulder a little bit. Get a little bit of that tension in the joint there. Punchy. Bad shoulders, bad neck. They're connected. A lot of people say, hey, while you're working on my neck, my shoulders hurt. They connect. While you're working on my lower back, my neck hurts. Vice versa. It's all connected. You can't have a change in one area of the spine. You can't have a weakness in the other, one area of the spine without something compensating for that. So if he's weak up here, another area has to tighten up to make up for that. Otherwise, we fall over. Same with the curvatures. You've got too much curve in one area of the spine. Another area has to flatten out. Some people will have a very straight spine. We've got some tightness down there. You know he's hurt his lower back before. So we'll do this one on the bed. It's not optimal. Let's see. Do it without the pillow. Head down here on that end, facing out. He's got fourth lumbars twisted out of place. Every bone has what we call a friend or a brother on the opposite end of the spine. So lumbars relate to the motion of the neck bones. You got a twisted lumbar, you usually got something twisted in the neck.
If one thing's locked into place like this, another bone has to do the exact opposite down below. Because if your head's this way, you're just going to fall over. So something has to. If I raise my hip, my shoulders have to compensate if I go the opposite direction. It's always subtle. It's hard to tell if you can't see it. She moves. Good. Hard to adjust on the bed, spring. Face the picture over here again. Better. Sometimes, if you're having trouble feeling the lumbars, what you can have them do is pitch forward a little bit, and I'll have them stick out, and then you can see that torsion better if they're twisted. Like right here at the bottom, L5 is going the opposite direction that L4 was going. So when people say sciatica, it's actually here. You get one nerve there, and then actually one from the sacrum. So they branch together here in the butt, one big nerve. And the muscle there is the piriformis. So if that muscle's tight, actually I find sometimes it's the overstretched piriformis muscle that compresses it. So people are like, oh, I have piriformis syndrome, and they're constantly stretching an overstretched muscle, which actually makes it worse. So if it's making it worse, try the other side, even if it's not the most painful side. Stretch the side that you don't have sciatica on, maybe. Not always true, just try both of them and see which one's tighter. That's the best way to do it, so you don't put yourself in more pain. Sciatica is a very broad term. I'm doing here in the skull is I'm just checking a muscle reflex, like when they tap you in the knee with the hammer, like one knee will kick out, and they'll check the other knee to make sure it kicks out as well. That shows that nerve, the deep tendon reflex, is equal. So that's all about the spine. You're not thinking about that reflex, the spine is telling you that it's fine. So if one doesn't kick and the other one does, there's pressure on one side of the body. There's something wrong with the spine. There's tension somewhere in the nervous system. Or maybe one's hyperactive. It kicks out way too much. That's another sign. So what I'm checking is I'm checking for an equal balance, which is not equal yet. So it tells me there's more to correct in the spine. Got another one in the neck here. And what I'm finding is C2, and we adjusted L4 last. So L4 and C2, because they're both the second ones in, they're what we call Lovett brothers. Dr. Lovett was an MD who found that every spinal bone has a brother. So atlas, L5, occiput, sacrum, and it works its way up and in. So he was twisted, trying to remember now. Yeah, he was like that. Now this one is doing the opposite. It's here. So we corrected that one, and then this one appeared next, and that's very interesting. So they both want to be corrected together. So sometimes if you're adjusting a bone, and that one keeps reappearing every time you're working on them, go to the neck, check the Lovett brother on your back. Don't just adjust the Lovett brother just to adjust the Lovett brother. Make sure you got a cause. You got either a reflex or an x-ray to confirm, a motion palpation, something. Don't go willy-nilly in there and start cracking things for the fun of it. I feel his neck is much different now. I can feel like it's not as gushy since I released some of that lower back tension. Like I said, the neck can affect the lower back. It could be the opposite. It could be the foundation affecting the neck for sure. That one actually moved a little bit. Another thing you can check, like I looked at his arms to make sure they're even. You can also look at the legs to make sure they're even too. Make sure he's straight too. Use the malleolus here. That's the inner part of the tibia. And you can see it's a little off. So there's probably something still. It could be a knee issue, but let's check them. Keep checking the neurological reflex still. It's balances. So stand up. So some persons, you may correct one thing and they'll balance, and that means leave them alone. It needs to process that. If you overload the nervous system, that's when they feel awful. And sometimes it even bothers them. So you only want to correct what the body's ready to handle. In the thoracic now. In the middle.
In the middle of the night. On your stomach. Let's see if this works. Since I don't have a table, I'm not able to correct everything that I'd like to do. I don't do a lot of side posture because it's hard to lock everything down, especially if somebody has a sprain. It's very easy to sprain the joint with side posture. So I've actually found even just grabbing something and setting it in that way is actually sometimes better. And obviously you can't breathe if you don't have a table. This is an area of fixation. Down here was weak, up there was weak. I felt like when I was fixing those. Here I feel like we might get actually a good crunch, which I know he's been waiting for, because that's what patients come back for. They don't want all this blabber. They want to feel the crunch, to feel like you've made a change. Put your neck in the middle just for a second. Breath in, breathe it out. Right. Areas of fixation are the ones that'll pop. But usually they're the areas of compensation. They're not the cause, they're a symptom. So let's check his legs again. Stand here so you can get his feet. No, not you. Camera lady. So head in the middle there, Jared, for a second. Get low with the camera so you can see the feet there. So they're actually pretty close. If you're looking level with it, you can see that right one's a little lower. So let's check as we go farther. It's a little stiff there, a little different. So I got some issues with the sacrum. You can see how the butt kind of shifts to the right a little bit as we come up. That goes back center, and then we bend the knees. So that affects the legs too. So check them when they're bending too. That unevenness is an issue. So you can see the tailbone here is off to that side. So even if I do like a light press like that, where I'm not even correcting anything, that should change the feet. So you can use that